Hello again, and welcome to 5 Minutes With. And this morning we're joined by myself, Dr. Phyllis Murphie, PhD, are joined with Dr. Louise Oliver, GP, with special interest in breathing. So, Louise, dive in. Tell us about yourself.
So I'm Dr. Louise Oliver. I've been working as a GP for over 2 decades, and I've got a particular interest in women's health. But in more recent years, I also work as a functional breathing practitioner, helping others to re-establish 24-hour breathing as nature intended.
Oh, right. Okay, thank you. So tell us about the because I've seen on social media your recognition of more patients, and you're changing what you're doing with regard to sleep apnea, which is, well, this is about sleep, so about sleep apnea and insomnia. Tell me a little bit more about that.
So with my GP hat on, I am seeing literally a hidden epidemic of sleep problems, but in particular, I think the one that we don't see or don't recognise enough is obstructive sleep apnea. And once I started specifically asking patients, do you snore? Do you stop breathing during sleep? My eyes were open to a hidden epidemic. And more recently now, I am actually referring patients for sleep studies who are actually denying snoring and sleep apnea. These are particularly women. They're complaining of other symptoms that can be a symptom of obstructive sleep apnea, and I'm still getting positive sleep studies.
Absolutely. Yeah, and that's a really good point. So I'm going to credit a lovely lady called Joanna Kipax, who taught me when we kicked off the charity. So this ties in with what you're saying in the postmenopausal woman. Our typical systems, we're so stereotyped, and but it's insomnia symptoms perhaps, but it's actually sleep apnea, and these women really need a home sleep apnea test, and then shock horror, wow, so the symptoms don't fit the stereotype. Phyllis, you're going to say something.
I'm seeing more literature published as well about it recently, and that's really helping to raise the profile in women, especially because there was one publication I posted a couple of days ago, and I thought people need to see this and actually recognise it, because they do present differently.
Yeah, it's easy to just think, sleep apnea, male, 50s, sedentary, obese. But we've got to, if we're going to tackle this estimated 80% undiagnosed, those stereotypes no longer serve us. Yeah. So primary care, where you are, because we're talking lots of experts in secondary care, but you're right there and you're seeing this under recognition. Could you, what else do you think about that?
Well, I think it's really easy to miss, particularly in people who don't present necessarily with snoring and apnea. We've got to recognise that with obstructive sleep apnea, sometimes people present with symptoms of having a disrupted sleep due to how they breathe. And if you have a set of symptoms and the person has obstructive sleep apnea that is untreated, no matter what that clinician does, that person will not feel as good as how they could be if that sleeping breathing pattern was changed.
This is funny how
of many different aspects to do that, and sometimes it's easy and sometimes it's more complicated. But the drive has to be that person breathes as nature intended when they're asleep.
Yeah, I mean, it wouldn't seem rocket science that to comprehend that breathing's kind of useful.
Yeah, and I think people forget when you assess a patient for sleep disordered breathing, they forget there's an airway up here. Yeah, the upper airway is really, really important. And what's going on in there is when I used to do my assessments, I would start from here and go down and go through the whole thing. I mean, even when I was being trained, they didn't teach us to actually look at teeth grinding and for bruxism and looking at the tonsil size. There's so much more to this assessment than just, do you stop breathing during the night?
Yeah, but the patent nasal airway, just come on, I know this is your territory, Louise. If you can't breathe through your nose, then you're gonna open your mouth. And if you open the mouth, the lower jaw or the mandible auto rotates backwards and narrows the airway. let's combine that with excess weight and lay on your back, and boom, there you are. All right, this is it. We'll wind it up. Yeah, are we all content with that? And we'll say thank you very much. 5 minutes with. See you for the next one.